Assalamualaikum and good morning, student. I am Dr. Abu Sufyan, Head of Department of School of Pharmacy Diploma course. Today we'll study about the new chapter that is diuretics. So first let's see about the definition of the diuretic drugs. Remember that the diuretic drugs are required when urinary output it is generally decreased. Okay. So to increase urinary output, to lower the blood pressure and to draw the edema out of the body, we are generally using a diuretic drugs. This is something which is very important because sometimes in case of retention of the water in our body, there is increase in the blood pressure. So to reduce the blood pressure or body water, it need to be decreased so that blood volume can be bring down and to we can reduce the blood pressure. At the same time, sometime in some clinical condition like congestive heart failure, where the heart is not properly working, as a result of that, there is retention of the water in our body. And to avoid that retention of the water, because the retention of the water, it may lead to the edema. So if you want to reduce that edema, we can also use the diuretic drug so that there will be increase in urinary output. And due to increase in the urinary output, we can reduce the water content which is retained in our body. So first see about anatomical review of the kidney before understanding about the diuretic drugs. So remember that the functional unit of the kidney, it is a nephron. So if you look at this complete structure, it is about the nephron. So kidney has three basic process, especially the first process, it is the filtration. Second process, it is active secretion. And third process, it is reabsorption. So these three process, it is carried out by a different part of the nephron. So first, let's see about quickly the anatomical view of the kidney. So if you look at here, so this part that is highlighted over here, it is called as the nephron, where the blood which is come from the heart, it is filtered. Then this part of the nephron, it is called as the proximal convoluted tubule. This is the distal convoluted tubules. Then there are two loops. The loop which is coming down, it is called as the descending loop of the Henle. And the loop which is going up, it is called as the ascending loop of the Henle. In addition to that, at the end, the urine it is collected into collecting drug, and through the collecting drug, the urine it is further processed into the ureters and move into the bladder, especially for the purpose of the excretion. Okay. So now let's see where filtration it is occur. So if you look at this part, that is called as the glomerulus. So this is the part where the blood which is coming from the afferent arterioles, it is generally the filter through the glomerulus. Okay. Then there is the process called as the active secretion and the reabsorption. So the active secretion it has happened especially at the proximal tubules, and the reabsorption. So whatever which is secreted out of the nephron, it is again reabsorbed back into a nephron by the process called as a reabsorption. So this reabsorption it is maximum had happen at the distal convoluted tubules and up to certain extent during at the descending loop of the inlet. Remember that something which is secreted, it will be something which is reabsorbed, it is go and back into the blood. And something which is secreted from the proximal convoluted tubules and distal convoluted tubule, it will be collected into the collecting duct and it will be further excreted through the process of the excretion through the urinary bladder. So this is the normal process of the kidney where we have seen the three process, that is filtration, active secretion and the reabsorption. Now going ahead, remember that through these three normal functioning, kidneys serve following basic function. So first basic function, it is the cleansing of extracellular fluid. Second function, it is excretion of the metabolic waste and the foreign substances. Third function, it is the maintenance of extracellular volume and decomposition. And fourth one, it is maintenance of acid-base balance. Last one, it is the balance of the fluid and electrolyte levels. So in case if there is anything which is imbalanced, so we have seen these functions. So if there is imbalance in such functions, which may lead to a condition called as the polyuria, where there is just to urinary output, or the condition called as polyuria, where there is no urinary output. As a result of that, the body, the water, it is retained into our the body system. And this retention may lead to different complications. For example, retention of the body may lead to increase in the blood volume. And due to increase in the blood volume, there is also increase in the blood pressure. Also, there is increase in the retention of the water, especially the extracellular fluid. It may lead to the edema. So, avoid this condition. You are giving the drugs called as a diuretic drugs. Okay. So first, before understanding the mechanism of diuretic drugs and anti-diuretic action, first we must know that there are three different electrolytes which play a very important role in the kidney. First, it is the sodium, potassium, chlorine, and water. It is generally found in the water in the kidney. Okay. Now remember that the 65% of sodium and potassium and the water that was secreted at the proximal convoluted tubule, it is reabsorbed from the nephron and go back to the bloodstream. Okay. And here, there is also secretion of hormone that is aldosterone. It is also called as anti-diuretic hormone because this anti-diuretic hormone, it actually controls urinary output. So whenever there is excess of the urine, there is natural process by which the ADH it is released. So ADH it is nothing but aldosterone it is released and it controls excess of the urine or it controls the urinary output. Okay. So when BP it is low, whenever there is low blood pressure, remember that it activates adrenal glands, especially to secrete the aldosterone. Now, what will happen with the secretion of the aldosterone? Aldosterone it is going to especially the reduce urinary output. Okay. So due to reducing the urinary output, the water content which is retained in the body, it will help to increase the blood volume and also it will help to increase the blood pressure. Okay. So aldosterone, it causes sodium to leave collecting duct. When aldosterone causes sodium to leave the collecting duct, always remember that along with the sodium, there is also movement of the water. So when sodium moves, water will also move. Okay, from the connecting duct. Since it is going from the connecting duct, it will not go into urinary duct, into urinary bladder. As a result of that, since it is not going into urinary bladder, water going into the collecting duct, not going into urinary bladder through collecting duct. So it is going to reduce urinary output and it will go back and reabsorb into blood circulation and it produces the action called as anti-diuretic action because water it go along with the sodium and it go out of connecting drum does not go into urinary bladder so it is not it will not excrete through the bladders. Okay, so this is how there is anti-diuretic action. Now, if you want to especially have diuretic action, then in such cases, what we need to do is we need to stop secretion of the aldosterone. So, aldosterone inhibitors are also one of the category of the drugs which are diuretic in nature. Okay. So, thank you for listening to me. Wish you best luck.